What's up, Boob Squad? It's Chelsea, mother of two and certified lactation specialist. I haven't made a video in a long time. It feels like over a month or so, but things have been busy. But I wanted to hop on here really quick just to address breastfeeding and the coronavirus. There's a lot of myths and rumors out there and crazy pandemonium, and I just want to go over some key facts that have been put out by the CDC and UNICEF. I have to say right now that I'm so thankful for breastfeeding, just because it reduces the risk of having to go out to the store and buy formula and being in contact with the general public. In a lot of cases, people are buying the formula in bulk. So some places have actually ran out of formula, which is super scary. If you are a formula feeding mom, I'm praying for you, hopefully you and your family have everything that you need to make it through this quarantine if things happen to shut down and we're subject to staying in our houses. But I just wanted to make this video really quick. So as far as UNICEF, what they have found is that we can continue to breastfeed just like we would with any other sickness. They said in one of the cases of a mom that was nursing that had contracted COVID-19, she had it, but the virus wasn't found in her breast milk. What you want to do in those types of situations, they said, wear a mask if possible. That way, if you're coughing, the little droplets aren't falling onto baby. And making those proper precautions, washing those hands, washing the area, making sure that all the surfaces are clean for baby, just like you would if you were sick with any other sickness. If you're pumping, of course, if you're just feeling way too ill to nurse, because I know that sometimes when you get sick, you just don't want to nurse, and that is perfectly acceptable. You can express milk for your baby. Again, you're going to want to wash those hands, sanitize the bottle, sanitize the nipple. A key factor that they didn't put up on the website is if you're going to be bottle feeding, then make sure that we are pace feeding. So, holding the baby up at that 45-degree angle, offering a few suckles, and then tipping the bottle away every so often so the baby has a chance to breathe. I would even, if you're a new mom and you have a really little one, I would go with spoon feeding or cup feeding, just so when it's time for baby to go back to the breast, that there's a minimal chance of baby having any type of nipple confusion or nipple preference. Some people use those two terms interchangeably. I believe what I've seen is that babies that have the bottle nipple, they just get used to sucking from the bottle nipple, and it's not impossible. I won't say that it's impossible, but sometimes they can prefer the bottle nipple over the regular nipple, which can sometimes look to moms like they're suffering from low supply, because baby is fussy at the nipple, they're backing away, they don't know they're like, I want that fast, immediate, instant gratification that bottle nipple gives, versus suckling and stimulating the nipple and then getting a letdown. They're like, no, this doesn't happen with the plastic thing, give me the plastic thing. So if you can, try to avoid the bottle nipple. If you're just like, if the caretaker who's offering the bottle is just like, nah, I'm not doing that, then at least make sure that they're pace feeding, because that's super important. And then the actual expression, cleaning the phalanges, making sure that your hands are always clean. I don't think I can say that enough. Making sure that your hands are always clean, warm soapy water, get the soap. I know people are freaking out about the tissue, but get the soap. And make that a strict rule in your house. Anytime that you go outside and come inside, make sure that you're washing your hands. These are things that we should be doing anyway, but especially with this virus, you definitely have to make sure that you're washing hands prior to pumping. And then they even said in cases where pregnant women had COVID-19, it's not 2019, not 2015. But anyway, in cases where pregnant women had COVID-19, their infants weren't affected, the infants in utero weren't affected by by the virus, which is stellar. Like, I think that that's so cool that women's bodies can respond that way, and keeping the baby safe at all costs. I think that that's awesome. Our bodies are awesome anyway. We give birth to these little humans, and then we're able to feed said little humans with our bodies. So continue to breastfeed, continue to nurse on demand. Supply and demand is almost always, in most cases with most women, supply and demand will always occur with breastfeeding. Babies showing signs of wanting to latch them on, and your body will respond by making the proper amount. Now, if you're exhibiting symptoms of the disease or of the virus, then seek help immediately. I don't think that it's worth waiting for symptoms to worsen or for you to spread the disease to other people, especially in your household. Those are the people that you love the most. So the coughing, the shortness of breath, I've heard those are the ones that are outlined by the CDC on the website. I've heard from a medical professional or a medical student that they also show signs of like diarrhea and tiredness too, along with the disease. So if you're feeling that, then you want to make sure to seek medical attention. Now, I'm not saying you catch a headache and you're like, I gotta go to the doctor, because the last thing that we want is to expose ourselves unnecessarily. But if you have that fever, the shortness of breath, the coughing, the sneezing, the wheezing, then definitely take care of yourself. Take care of yourself, wash your hands, take care of the ones that you love the most, all those things. Now, I also wanted to address like the whole formula feeding scenario too, just because it's like you can't talk about breastfeeding without talking about formula, because if you do so, then it almost seems like you're bashing formula, and I'm not at this time. Like, this is not the time to say one's better than the other or anything like that. What I'm saying is you want to make those extra precautions to make sure that you're preparing your baby's formula bottles properly. You are getting a can of formula from somewhere else, some store, and you don't know who's been there, you don't know who's touched it, you don't know a lot of things about this can that you're picking up. So we want to make sure that we're following the instructions that are on the outside of the package and that have always been recommendations for people that are using formula. So sanitizing the outside of the can when we get it home, sanitizing the surface that you're preparing the formula on, washing your hands prior to preparing the formula, and then mixing the formula properly. That is so important. At this time, like with people buying in bulk and with there being somewhat of a shortage, if there is a shortage, I know that there's been people saying that they can't find it on the shelves, they have to go to several stores, all those things. Please do not try to cut the formula, stretch the formula, make the formula last. Reach out to some of these support groups. Some women have additional formula that you can use. Please do not stretch the formula or try to dilute it or anything like that, because those are crucial nutrients that you're taking away from your baby, that can cause serious harm. So I want, for those that are using formula, to offer the formula in the way that it's meant to be offered every single time. And this is not me judging. I don't want anybody to think that I'm judging. I just would like to keep all babies safe all the time. And while I am the Boob Chronicles lady and I talk about breastfeeding, I promote breastfeeding, I love breastfeeding, I understand that it's not for everybody. And if you've made it through all those steps, if you made it through the whole video and you made it through this video and you're like, she wasn't going to talk about formula, I did, that's for you. But I just want to keep everybody safe. If you have any questions or concerns, most of the information that I found was on UNICEF's website. They promote making sure that children are healthy. Also on the CDC's website, also concerned with keeping people healthy. So you can find the resources there. be encouraged and reach out to your local lactation consultant if you have any questions. You can type any questions down below. Like I said before, supply and demand, supply and demand, supply and demand. Wash your hands, wash your hands, wash your hands. All those things during this time, and y'all be blessed. Bye-bye.